Hello, everyone, and welcome to another episode of Beyond the Superficial. We are chiropractors and functional medicine practitioners at Synapse Center for Health and Healing, located in Eagan, Minnesota. Information shared in this podcast is not intended to diagnose or treat any medical conditions. Please consult with a primary care provider before engaging in any new activity or protocol. With that in mind, let's dive into this episode.
All right. Well, welcome to another episode of Beyond the Superficial with the female doctors at Synapse Clinic located in Eagan, Minnesota. Today we're going to be talking about the topic of AK testing. We're going to kind of dive into what it is, why we use it, how we got into it, and kind of just give some information about what we can provide here at the clinic along those lines. So what we're going to start with is just kind of what is AK testing, and kind of go from there. So yeah, Dr. Ashley, how do you explain it to your patients when they haven't had anything like this? It seems weird. You're walking in the office like, what are you doing? So yeah, what do you say to your clients?
So AK stands for Applied Kinesiology. So we use kinesiology, so how our body works. So we use the muscles and nerves and all that to give us information, really. So essentially, nerves control muscles. Muscles are attached to our bones. Our spinal nerves come out of our spine. So essentially, we use this feedback loop. Muscle nerves control organ systems. So we use all of that neurofeedback loop to use it as really a diagnostic tool to some degree. Maybe not our only diagnostic tool in our toolbox, but can really help us point to a certain direction. So essentially, yeah, that's how I explain it is. We're just using our body and like what God gave us to just give us more information and point us in the right direction. Yeah.
I always talk about like the communication part of the nervous system. So I give people an analogy. I feel like I learned it in analogies. So like I had one mentor that told me, it's like if you plug a light switch in the outlet and you've got the cord that shines to the light bulb and it tells the light to shine. But as soon as you unplug the cord, the light goes out. And so it's kind of like your nervous system. Your brain is always sending feedback to your cells, your tissues, your organs, your muscles, and that's how you function. But we're looking for the breakdown in communication because that's what leads to dysfunction. So that's kind of how I phrase it to patients. Mm-hmm. So that's why we muscle test. It's not about the strength of the muscle. I have a lot of patients that are probably stronger than me, but it's about the communication and is there a breakdown from your brain to that muscle, and then why is there? Mm-hmm. So that's kind of how I explain it too.
Yeah, no, that's really a good analogy. So I always talk about, with the muscle testing, when you come into my office, kind of along the same lines, if I find a weakness in one side of the body, in that muscle, I think, is there a joint, nerve, muscle problem? And then if I find that weakness on both sides in that same muscle, I start to think, what's that shared inner connection to other systems, like what you talked about, the organs. And it just helps us kind of hone in on what's going on. Mm-hmm. And I always explain it too as like, if you had a bruise on your arm and I went and tapped your arm, you can see how that might make your nervous system and your muscles go a little weak. Mm-hmm. And so that's kind of the same concept. When I have a patient touch different parts of their body, or I might touch different parts of their body, they just have that little feedback and it weakens that system. And so that shows up in the muscle testing. And I was going to, it's not something that is gold standard in my mind. If I muscle tested, I might get different information than if you muscle tested. Mm-hmm. And so that's where we're just using it as part of the exam. Mm-hmm. I find that some patients are really good at communicating this way because they've been trained and they want to communicate this way. And so those patients, yeah, they really kind of show up and show that weakness really nicely, where others don't. If you're really guarded, or sometimes I think like high dopamine, anxiety, sometimes those muscle weaknesses don't show up, and then it's not a good option. But yeah,
it's kind of like a diagnostic tool. I think. I mean, we all went to chiropractic school. We all learned the same basics, but there's so many different ways to figure out where to adjust someone. So we'll use it for structural things, and I think that was different for a lot of patients. I do have a lot of patients who are like, yeah, I know about muscle testing. I've done it with other providers, but the structural part was different. And so what I say to them is it helps me determine where you need an adjustment and then how to do the adjustment. So I can do motion palpation and do a lot of other testing, and that's what other chiropractors do. This is more of like a diagnostic tool to say, where do you need the adjustment? And then we recheck it. So I think I have a lot of patients that like that aspect where they can feel the muscle weakness. I say maybe L5 in your low back needs an adjustment. We do it, we retest, and they feel the immediate change in the strength. And so they know that adjustment helped me. It was restoring the function, and that helped. So,
because sometimes you can motion palpate and it can be off in a certain way, but you end up adjusting and it doesn't correct the problem.
Exactly.
And so that's where what you're talking about, the muscle testing helps us understand, like, well, where really should we adjust to correct? Because maybe we need to adjust the segment below, or maybe we need to adjust the thoracic spine, and then that starts to correct the alignment, and then we no longer have to adjust the area that we thought maybe we had to adjust. And muscle testing kind of helps weed that out a little bit.
Yeah, and that's what I love about muscle testing too is, I'll use it, muscles weak, okay, I'll adjust that segment or, use pelvic blocks or whatever. And then if it's still weak, I'll kind of go to the muscle directly. Okay, do we just need to do a little muscle work in that area? That still doesn't turn on the muscle. Then I'll dive a little deeper. Okay, where is this muscle related to an organ in our body where they share that same like neural connection? And that's where I use, different supplementations if I can get that muscle to turn on. Typically, I'll use like our test kits that we have. So I'll test a nutrient on our tongue. Our brain recognizes that nutrient on our tongue instantly. So I know it'll turn off or on a muscle, or even, take care of like a hot adrenal point, for instance. And so I'll kind of use that to guide my treatment. And again, this can also like point me in the direction of like the type of lab testing I might need to do too. Because like if their adrenal neurolymphatic points are super hot for some reason, like, okay, I probably need to dig into this a little bit more, or like run some more intensive hormone tests. Kind of not like a main diagnostic tool, but again, pointing me in the direction. And honestly, like people's budget too, functional medicine testing can get super expensive. So if we can get some hints on just some muscle tests, it might not be a bad idea either. Sometimes I do.
Usually I go structural first and then biochemical, so like organs and then emotions. But I tell my patients too, I'm like, if you have a heart attack, you get referral pain to your left shoulder and arm, but it's not a left shoulder and arm issue. It's coming from your heart. So like that's an example of an organ that's not working well, it's stressed and inflamed, and it's showing up as a physical issue. And so I feel like I see this a lot with like low back issues. So many people in society right now have gut issues.
Right. Yeah.
And so a lot of times, like on exams, you guys probably see this too, there's a lot of weak core muscles.
Yeah.
And it's because the digestive system is inflamed, it's shutting off the core muscles. And how does that manifest as low back pain? So maybe the gut issues cause the low back pain or vice versa. So they're always connected in the body.
I love that you bring that up, because I actually have a bad review
on
our because I made that connection with a patient, and she's like, I can't go there. So I love that you just brought it up.
Shoot.
No, it's so true.
Well, and that's where it's so cool to verify that with the testing that we get, like through the blood, because there's been so many times where like, I get weird with the muscle testing, and like their adrenal points are so much better with DHEA on their tongue. I'll run their labs, and sure enough, DHEA is absolutely tanked, and they're not making hormones. So it's like I feel like we have an opportunity and put in such a cool position where we do some AK, and we get to follow up with that with labs and verify and get more detail.
And that's the thing, like we say it's weird because other people and people don't understand it, right? Like. I mean, this is science. This is the body and how it works. It's the nervous system. It's just when people don't understand it, they're like, well, what the heck? Like, that's crazy. But when you start to learn the nervous system and how it works, like, then it starts to make sense. And that's the loss of the art of the physical exam. Like how many times you go to your doctor and they don't touch you at all. And that's okay. That's not how they're communicating. But you can gather so much information from things like muscle testing, feeling where the lymph is congested, feeling where the muscle tightness is, leads to where is that organ. Like so many times people will have a chronic sinus infection or a tooth infection, and they're just tight and knotted up to that area in the shoulder. So if this isn't clearing with muscle work and adjustments, then like, okay, what is making that nervous system and the muscles then respond to that nervous system signaling? Because all the nerves it's just connected everywhere. Here, this is cranial nerve 5, innervates your sinuses, innervates your neck muscles. The nucleus comes down into the upper neck here, innervates your cranial nerve. So you can have all those symptoms, everything tighten up because you have this infection here. And so when you touch the body, we muscle test, even if we hold here and that causes some pain and we cause some weakness, then we can hone in on that a little bit.
Yeah, that's so true when you say it. Like, you keep having to address an area week after week. And I use that too. That's how I use it. Like, if I keep seeing the same finding all the time, I know I have to dig deeper. Like, they're not holding that adjustment for a reason. So that's kind of another way I use it too.
Yep.
I always think like the body works as one system. So you might have 5 different symptoms or health concerns, but one thing probably led to a downstream effect of everything else. I've had so many patients where they have like an ankle injury and it's not their ankle, it's coming from something else in the body. And so that's super cool to see too, because you go through and test and it's actually, maybe it's coming from their low back. Maybe it's a gut issue like we talked about. Maybe it's something else. So everything in the body's connected.
It is crazy. I mean, I myself have, from college, I always carried my backpack on my right shoulder and it caused this massive knot in my left levator. And that thing, I swear, like, because now I struggle with migraines on this left side, like, and I really think it's that connection through that initial injury that I need to clear that's just compromising all that flow. Like,
Do you muscle test with supplements? Because sometimes I have patients come in with like big piles of supplements and they want me to muscle test. And how do you explain it as to like why things are strong versus weak to them?
So, I mean, again,
this gets hard to explain, I think.
It does. Well, I always talk about it as like, and I'm not a quantum physicist, I guess, is that the right word?
I don't even know.
I think it's quantum physics. It's the energy. Everything has its own vibrational frequency. And so when we put that vibrational frequency in your vibrational field, it starts to affect how you work. And so you have to kind of put it all together. I mean, yes, it's going through a plastic bottle, or, you know, I think it works better if we actually have the substance on the tongue. But if you're really good, I mean, this kind of goes into, again, how we work and then how maybe someone else is trained to gather that information. Like, maybe it's just sitting in the room and asking the body, you know, what do you like? You know, asking the patient even on like a telepathic type of, you know, level. I mean, some practitioners are good with that. And I think that's more of like a quantum physics kind of thing. I mean, they've shown that a person can be in a room, there's thermal energy imaging, the person leaves the room, part of them stays in the room. I mean, those kind of things are shown. Again, I'm not an expert. It's just dabbling and having fun with it. But that's kind of how I explain it, is just that vibrational frequency of that, from electrons to protons, everything is made up in a different combination from organic chemistry, and that vibration starts to affect your vibration. And so that's what's cool too, is when you use this, like, you know, is a patient ready for antibiotics, for example, or like, you know, are they ready for it? Ready for this supplement? Testing it that way, it just gives a little bit of information. Again, taking it with a grain of salt, putting it together with the big picture, but it does give some information.
Yeah, what you said about like sort of the frequency or electrical frequency that everything has, like our body has it, a supplement has it. That's how it was explained to me too. If we would like use supplements with muscle testing, that's how it was explained to me. I don't do like a ton of it, but like if someone wants me to muscle test, you know, for some supplements, like I'll definitely do it for them. But that's where I usually, you know, do the combo of the lab testing to identify you know, maybe which kind of supplements I need, and I can like fine tune it too if muscle testing is needed. But usually that's where like labs will come in as well. Which supplements we need.
I definitely go more. I rest it for myself, at least, more on the labs. But again, like you said, from a financial standpoint, like we can do a muscle testing session for $80 versus $450 for a lab. You know, so if it's that, at least it gives us some information. And honestly, like, it's pretty amazing to see like the benefit, like the results of that. It does give some good benefits. So.
I talk about the frequencies too. The analogy I was given is it's either like magnets, so they attract or they repel. So they're either going to do well in your system or not. Or like if someone walks in a room and they're in a bad mood, you can typically tell before they say anything. It's just, it comes down to like the energy or frequency. So that's what I tell my patients. In terms of supplements, I would say the only time I really do it, unless someone asks, is maybe they have like an adrenal issue. We have so many adrenal products,
That's
and so
exactly
I will
what I
sit
do.
and I'll pull
Yeah.
them all out because they all have different things. I don't totally know. I mean, maybe off lab values, I have a couple, like 3 supplements I think would do well. Which formulation is going to be best for them? So sometimes I'll go through like different brands and test those, but I think that can be helpful. Or like blood sugar issues, or like thyroid. There's a lot of things there. Detox powders. So
Yeah, I know. You kind of made me think about that with the person walking in the room and you're not jiving with them all the way. So there's a fantastic book called My Stroke of Insight. It was on Oprah's bestseller list or whatever, like 15, 20 years ago. And it's a neuroscientist who had a stroke and she lost, I think it was the left side of her body or left side of her brain. And with that, she was able then to see auras and feel the energies. And she talked about how different doctors would come into her room and she could be herself was affected positively or negatively by their energy. And she talked about one doctor, he's going to be a great doctor, he's an intern, I think, because of the energy that he brought into the room. And I think even from a functional neurologist standpoint, like we all have this, probably in our midbrain and our like lizard brain, and being able to see like different lights and different energies, that kind of thing. And then we got our big frontal lobes, and we then started relying on other pieces of information. So I think we probably all have some of that gift. We just have to like tap into it and get down into it. So feeling
it's a real thing.
Yeah,
for sure.
Well, don't we only use like 10% of our brain or something, and the rest is just like we don't know like what it could be capable of.
Yeah.
How did you guys get into muscle testing? Because I get this question a lot. We don't learn it in school.
Yeah.
So we don't learn anything about it. It's all outside training. So
I like through, I don't know, like I was in 6th grade and had a basketball injury. and I just went through a lot of like Western medicine for those issues and never really got any relief. It was just like a lot of medications that just weren't helping, and all the symptoms or side effects that come with that. And I really only got relief from a AK provider who did muscle testing. Shout out Dr. Alicia Palmer. She just really cared and like wanted to like get to the root of the problem through adjustments and muscle testing and everything. But yeah, it was really like specifically like 1 or 2 providers that really like shifted my mindset. I was like, I want to be just like you, Dr. Alicia. And so that's like really what jump started like my whole journey with like getting into chiropractic school and finding the AK club and doing all of that. And I even had like one chiropractor actually who it was way in undergrad, and he was like, I swear if I see you doing the AK something, like I'm gonna kick you into next week or whatever. I was like so against it. It's just crazy.
Yeah. There are.
I'm not gonna listen to you. But that's how I got into it. Another provider took care of me, did a good job.
Well, I got into it by coming here.
And I don't think I knew that.
I don't think I did either.
Yeah, when I joined here, I thought I was going into a functional medicine or functional neurology clinic because I was new into functional neurology, and so I came here to try and learn that. And then, unbeknownst to me, it took me a couple of weeks to figure out I'm like a functional medicine clinic, and we do AK testing.
That's a surprise.
So I was kind of forced into it, and then but just over the years, just definitely just learned as I go with it. And I worked with other AK providers at my previous job, so it wasn't new to me. It just I hadn't practiced it, so I kind of was thrown into it, and now it's just a part of it. So
cool.
Yeah.
I grew up in a chiropractic family, so my dad is a chiropractor. He did not always do it though. I don't know, I guess he just wanted to do some education, so he started doing it. I just really liked it. Like I was in a lot of sports growing up, and I could tell a difference after the adjustments, and I really liked seeing, okay, my muscle went from strong or weak to strong after that specific adjustment. So it just resonated with me, and then I ended up doing a lot of seminars and like outside stuff. So for me, I liked it because it tied in with the functional medicine side of things. I remember at some of the first seminars, they talk about like the triad of health. So like structural, mental, and chemical imbalances in the body. And so that just resonated with me into the muscle testing and then like the functional medicine, just getting to the root cause type of thing. So yeah, lots of seminars and outside stuff.
That's where I met your dad.
Yes, you
AK
did.
seminars.
Yes. I don't think I was there though back then.
No.
Yeah. I was too young.
Yeah. Well, I was going to bring up some other things too. This is kind of going down a different like rabbit hole, but through like the AK testing and then just being kind of open to like when you walk into a room talking about the physical exam, like when you walk into a room with a patient, if you just allow yourself to listen and then we start a form of communication with the patient, and it's kind of tapping into like how are they going to communicate with you, how are we going to have this conversation about your health, and different clients will want to communicate in different ways too. I had the pleasure of working with a patient who was truly a healer herself. I felt bad that she was seeing me because I felt like I was learning from her more than she was learning from me when it came to healing. And like what you were talking about, you can feel that, you know, some will come in my office and say they're healers, but they're not. And then some will, and she was, but she kind of, and I had been asking and kind of for myself praying about kind of going to the next level too, or kind of hearing other ways of learning about things similar to AK. And she actually taught me how to use a turkey feather to feel the energy. So what we do is she taught me is to go down like along the spine, and the turkey feather would lift in the areas of problems. And so it's just another example of like another way that doesn't seem, it's not mainstream, to just gather that information, because that's just energy coming off of the body and changing the field around you. And it was wild. It was wild.
I had someone adjust me a couple times, and he did it off breath. Okay. And so I would lay face down, and he, I think is what he was doing, he was watching how my spine would move as the breath moved through me. And he would put his hands on certain parts of my body, and whenever the breath would stop, he'd be like, okay, there's something going on in there. So it's like kind of similar to that. And I thought it was crazy, but yeah, I mean, if you watch him do it and you watch the patient, you see like the breath stops at certain parts, or he'll just kind of put his hand on like your spine, your sacrum, your pelvis. It was super interesting to see how your breath changes. So yeah.
Well, and then because I have some patients who see providers who treat from a distance too. You know, they can just communicate through just the phone or just do that. I had another thought with that too. Oh, go ahead. I lost it. I can't remember what I was about to say, but it was along those lines, which is feeling that energy as it comes across. But
I definitely have gifts.
For sure.
That's what it was. It was like people who are just medical mediums. And I mean, just even from, we've talked about this with the trauma podcast that we did. Certain areas of the brain have to do with that gut feeling, and that's the right insular cortex is one of the areas. And some people can have a heightened just development of that area of the brain. And so they're very good at feeling and having that gut instinct. So they might be able, just kind of like a dog is really good at communicating just with body language, watching you. Some of these people can pick up on just those, like, how are you carrying? What's your gait? Like, where's the tension coming in? Like, and putting that all together. And I just, we can make sense of it from a neurological point. It doesn't have to be like, oh, this is just weird. No, from neurological, like they might, for example, have just a really heightened area of that brain, and they can definitely feel and sense those differences. So
I remember talking to some like AK providers that have been doing it for longer than I have, and they would say like if they muscle test someone, you almost get to a point where you can tell if it's going to be strong or weak before even touching them. I don't know if you guys feel that too, but I mean, you can kind of tell sometimes. Or if you, like, we will test for like food sensitivities or toxins, sometimes you can just kind of sense what's going on. Like you can tell if someone picks up their leg, if it's going to be strong or weak before you test it. So kind of along those lines. It sounds crazy. It's not diagnostic, like you have mold toxicity or something, but that's why we back it up with lab testing. It's just another diagnostic tool. So I think it helps us be more well-rounded, I guess.
Yeah, and it's even like how the patient muscle tests too, like
Mhm.
kind of like what you're saying. Like some people, like I can not muscle test them. Like
Mhm.
like I can't pick up on anything.
Yeah.
And I know that there is something there, but I just can't pick up on it.
Mhm.
Yeah.
But then on the other side too, it's how they muscle test. Like the muscle might be strong, but there's just the slightest little bit of shakiness.
Mhm.
Yeah.
So you like learn to like pick up on like what their
What
break
there
is.
is. Yeah.
Yeah.
Mhm.
Because every body is just so
Yeah.
different.
Yeah,
Yeah.
absolutely.
Crazy.
Yeah, because I tell people too, I'm like, you're strong, but you're shaking, so that might be your positive. Or, yeah, it might be not an obvious like I expect, but maybe it's their way of showing me. Yeah,
Mhm.
and then we'll kind of see that pattern as we go through.
Yeah.
So, yeah, and I noticed too, just treating Dr. Troy's patients who had seen him for years and doing AK, like they're very good at communicating it that way to me. I'm like, that's weak, that's strong, that's weak, because I think the patient also has an intuitive sense of, what's wrong with them. And we just have to bring that out to the forefront.
Yeah.
Yeah.
Yeah. People like almost like try and fight it.
Mhm.
I'm like,
You can usually tell though.
yeah.
Yeah.
If I see your whole body twisting and you're trying to keep your leg up, I know something's not strong.
Yeah.
Yes. Yeah. Any other cool insights or inputs?
Those are the basics of it.
Yeah,
at least.
so-
yeah.
So yeah, here at the clinic, I guess what you would come in for, what you would be. I mean, we use this kind of standard. Our exam is not just this, but we use AK testing even during the exam. We use it during our adjustment times, and then we will use it for specific appointments for like supplement or food. And we haven't used that. We've definitely gone more towards labs in recent years for that, but that's still an option and still an availability. We use it for looking at emotions, again, not as a therapist, but looking at that limbic system, that nervous system feedback because of emotions that are showing up. So we might use it to help kind of remap different areas of the brain too, to help with the emotion and thought side of things. Anything else that we
I guess mold. I've had patients collect like mold in like a petri dish and like grow it for a few days in different areas of the house, and then we just muscle test like where like the most impact is. Maybe where they want to target remediation or where they want to put like their air filter, like where it's coming from most. Yeah, so I've used that too. Just have people collect mold samples.
And we'll use it for infection. Again, not to diagnose infection, but again to kind of lead us to, should we do this lab test?
Yeah, because some of them are pretty expensive.
Yeah.
It's like before spending $600, you kind of want to know, do we think these things are going to come up or not?
Yeah. Heavy metals, environmental toxins, we'll use it for too, just to get a little idea.
Yeah. I always just tell my patients it's just one technique. If you go to 5 chiropractors, they're all completely different. They're going to adjust completely different. We probably all muscle test differently. So it doesn't mean it's like the gold standard. There's no right or wrong. I think if you can help your patients and you can get them to their goals, then it's a good technique to use. So we're all different.
Yeah, absolutely.
We're all gifted in our own ways.
Yes.
Well, we will end on that note. Thank you for joining us, and we will see you again later.
That concludes today's episode of Beyond the Superficial. Thank you for joining us, and stay tuned for more episodes. For more information, please visit our website, www.officialsynapse.com, your partners in healthy living for optimal life. We would love to hear from you on how our podcast might be impacting your life. We also want to hear what interests you. Please leave your feedback on our media page at www.officialsynapse.com. Thanks again for listening, and we'll catch you in the next episode.